When I have patients who have had surgery more than twice in the last year, I'm often asked before they go in the operating room, often the night before when I'm calling them on the phone, they'll ask, "Hey, doctor, will I be okay if I get surgery again or anesthesia again?" And it's a very valid concern because what happens to the body, the mind, the brain from repeated exposures to anesthesia and surgery, the surgical stress. So I'm going to share with you three main things that happen from surgery on our body, our mental health, and specifically the anesthesia risks, the memory loss being a big question as our anxiety, depression, PTSD, etc. And I'm also going to share, importantly, some ways that we believe those risks can be reduced or mitigated. So I appreciate you all for answering that in the poll, this topic that we'll talk about. I'm sure many of you can share this with your loved ones who are having surgery or friends. And you can probably see Karma the dog in the background. She's going to be a part of this because of the role that pets and pet therapy can play to help potentially reduce some of these risks. So number one is the risks of having repeated surgery. If any one of you has ever had surgery before, you'll know that, or you'll probably know that there is always a risk of what's called adhesions. Surgical adhesions, referring to the scar tissue that forms after any incision in the body or any cut or damaged tissue in the body. Unfortunately, anytime we have surgery, there's a risk of this scar tissue causing complications at any point in the future. A common example is what we see in any abdominal surgery, whether you've had bowel surgery, gynecological surgery, etc. All of those areas where the knife went through the first time can cause thick scar tissue, which might cause complications with other body organs in the future. A common example being what's called strangulated bowel tissue. Strangulated literally is like bowel that's getting strangulated, which can cause obstructions. We call these small bowel obstructions sometimes. If that scar tissue prevents poop, if you will, from going through the rest of your intestines. So anytime you have surgery, and the more surgeries you have, the more scar tissue you have, that scar tissue can always present complications with adhesions that can cause obstructions or even pain if tissue is getting stuck against those obstructions or nerves are getting stuck against those obstructions. There is always the complication of blood clots. The more surgeries we have, especially in a short period of time, this is a separate issue, by the way, the more sedentary we are if we have multiple surgeries, because often, as you know, you can't go and run a marathon after surgery. So if you have multiple surgeries in a short period of time, it means that you're probably not as mobile or active as you ordinarily would be. That increases the risks of blood clots, which can then go to your lungs and cause emboli, what we call pulmonary embolism. That risk will increase. Weight gain is a big one that comes up because the more surgery that we have, the more risks of being, as we said earlier, sedentary, of not being able to do the activities of daily living that we often do either for pleasure, which can lead to mental health complications, which can lead to weight gain, or just not being physically active will increase the risk of weight gain, obviously. And yes, this is Karma here. We'll get to her in a little bit, I promise. Weight gain is a serious one, especially when it comes after hip or knee replacement surgery, because oftentimes we do these surgeries to help patients become more active. But what's not said is that sometimes without the right mindset, that surgery will actually lead to weight gain and potentially less physical activity. That will underline so many of the benefits that the surgery is hoping to gain. And Alexis, good to see you on there. Chronic pain is a big one as well. And this is highlighted by the type of surgeries, because all of these surgical complications, of course, increase the more surgeries we have within a short period of time, but also depending on the type of surgery. I already mentioned, for example, that adhesions in the abdomen are going to be more common after gynecologic surgeries or any other abdominal surgeries, pelvic surgeries, etc. But in cases of spine surgery, we know there's this failed back surgery syndrome. The failed back surgery syndrome is going to be more common the more attempts at correcting back pain that you have. So the more interventions, the more adhesions, the more risk of entrapping nerves, the more potential for chronic pain, especially if it's in the same area of the body. complex regional pain syndrome, similarly, you increase the risks of this occurring after surgery, the more number of surgeries you have. And for cardiac surgery, for example, we know that so many risks to, for example, memory come from clots that go to the brain. And those clots are more common to happen when you are on the cardiopulmonary bypass machine. So specifically for cardiac surgery, the more cardiac surgeries you have, the greater the risks of brain complications. So the point is that the surgical risks depend on the type of surgery, where it is in your body, and it depends also on the medical risks you bring in. For example, when you have poor blood glucose control, if you're a diabetic, you are more likely to have infection risks with every surgery, because we know that unregulated blood glucose levels or blood sugar levels increases the risk of surgical site infections. For example, any other number, and we'll talk about this in the next couple sections, the medical health that you bring to the surgery will determine what risks are more likely to compound with more surgeries. Now, what can you do to minimize these risks? Well, I mentioned one already, and that's maintaining a solid blood glucose level. So the better controlled your glucose is, the less the chance of many complications, including infections. Of course, optimizing your body weight, having a healthy body weight before surgery, is also going to minimize many risks, including blood clots, including chronic pain, etc. Your nutrition is important. The less optimized your nutrition is, the less quickly your body can heal from the surgical wounds, the longer it takes to heal from your wounds, especially if you've had multiple surgeries back to back. The longer it takes to heal, the more pain you're going to have because your body is taking longer to heal. And then lastly, the concept of prehabilitation, which includes nutrition and includes physical activity, refers to the greater our cardiovascular fitness, it appears the less the chance of having surgical complications in the body. However, of the ways that you can optimize your body the best before surgery, your mental health optimization has the most evidence for and the greatest bang for your buck. And that's the next section. Number 2, mental health effects from multiple surgeries. Before we go on to that, I do see some wonderful comments here. I want to give shout outs to everyone who's leaving these insightful comments: Cindy, Matt, Maggie, Nadia, Sophia, Alexis that I mentioned, Steph. Thank you all for sharing with others your experiences to help empower others. As always, you know that I don't like to do any ad placements or product placements. So if you do hit that like button or share what you've learned with others, you'll help share this powerful message and you'll help support me doing this more often for you. I do see a comment about protein. Julie, there is a very important role for optimizing protein. I talked about it in other videos, because you do need to have the building blocks to heal tissues after surgery. Of course, we don't ever talk about the quality of the protein. It's something we can talk about in future videos, but there are various weight-based doses. You always want to speak with your doctor before to make sure that your body can tolerate those higher protein loads. And Alexis, thank you for that kind super thanks for treats for Karma. She very much appreciates it. We'll get to Karma very soon because we're going to talk about the mental health effects. And that refers to the dark side of surgery, because we talk about surgery all the time as healing the body, but breaking the mind, or fixing the body and hurting the mind. Because what no one talks about, in my experience, about complications, especially from repeated surgeries in short periods of time, are the risks of depression, post-operative depression, anxiety, and perioperative, meaning around the type of surgery, around the time of surgery, panic attacks, or PTSD, perhaps from anesthesia recall. And Patty, thank you as well for that super thanks for treats for Karma and Mochi. Mochi is actually off to the side on her cat bed right now, but Karma is right next to me. I'm sure the cat will come by as well at some point to say hi. Regarding the mental health effects, what also people never talk about is the isolation and loneliness that can be caused by surgery. When you're not out there with your family and friends because you're at home recovering, when you may not have someone to help cook for you because maybe your hands are in casts and you can't cook for yourself. You can't go and see your neighbors, etc. And this plays a huge role in worse outcomes because your mental health state after surgery will influence the risk of acute pain turning into chronic pain after surgery. More anxiety after surgery may contribute to kinesiophobia, which can lead to more blood clots, like we talked about earlier, greater weight gain, surgical complications in the form of frozen joints. What is kinesiophobia, you ask? Kinesia refers to movement, phobia refers to fear of. Kinesiophobia, therefore, refers to the fear of movement. For example, a common example is after knee replacement surgery. For any number of reasons, the patient might not fully partake in their physical therapy. I'm not blaming the patient, but it's a reality that happens time and time again. What happens when patients don't participate in their physical therapy fully or as much as they can or should? They have to come in for another round of anesthesia because we need to do a manipulation under anesthesia. What happens? Scar tissue that I mentioned from the first section can make a joint so rigid that they can no longer move their joint. Cindy Dotson, by the way, thank you for that kind super thanks as well. It's very much appreciated. When we have a tremendous amount of scar tissue around a joint and it cannot move, we call it a frozen joint. It happens really in any joint, but in particular, shoulders and knees after major surgeries, if they're not bending the joint around enough to help prevent that scar tissue from sinking in place. Well, you cannot break that scar tissue without another round of anesthesia because it hurts a tremendous amount. So oftentimes patients come to the operating room with me after having a successful knee replacement, but now there is so much scar tissue that we have to put them to sleep again while the surgeon cracks the knee. It is probably one of the most disgusting things I have ever heard in my life. Breaking apart all the scar tissue releases a tremendous amount of blood, by the way, so they have a lot of swelling afterwards. But that's the only thing that can be done to help remobilize the joint. So preoperative anxiety can lead to postoperative anxiety worsening and kinesiophobia. That's the link with these other surgical complications from the mental health state. PTSD is a different beast altogether, and that can happen when we might have some element of awareness under anesthesia in the operating room or in the intensive care unit. And needless to say, that PTSD, which we sometimes call medical PTSD, can be tremendously debilitating and might prevent patients from seeking medical care in the future. Do you know anyone who has had medical PTSD? I hope you don't. But I can certainly tell you that many of you on this channel have shared your personal stories of yourself or loved ones, and it is incredibly powerful. Damn it, Janet. Thank you for that super thanks. And you ask, what causes psychosis after surgery? Actually, exactly what I was going to get to right now. So you are right on point, Janet. The risks for post-operative delirium, which will of course compound, we believe, with the more surgeries you have in a brief period of time, are similar to the risks of post-operative cognitive disorders. And this also affects our mental health because the worse our depression before surgery, the more likely we are to be experiencing poor cognition before surgery. And the worse our cognition before surgery, the greater the risk of delirium after surgery and persistent neurocognitive deficits after surgery. So the causes of the psychosis, like Janet asks, we don't really know all of them, but we do know that pain, low oxygen levels, high carbon dioxide levels, poor cognition at baseline, not having a high level of educational attainment, having a poor social support system, and other risk factors that you can probably imagine quite intuitively can contribute to somebody having emergence delirium or ICU delirium. Other big factors include poor sleep regulation before surgery and after surgery. So not being on a circadian sleep cycle, which is not necessarily their fault, because if you're getting stabbed for blood draws every 4 hours, including overnight, you can only imagine the quality of sleep that you're going to have. What if the healthcare staff, maybe they're nurses, maybe they're doctors, maybe their cleaning crew, are joking around on the late night shift and you can't sleep, or your neighbor's TV is on and you can't sleep? These are all things that have a huge role huge role in developing post-operative delirium or psychosis, like Janet said. Your preoperative depression, anxiety, etc., will also presumably add a risk to psychosis and postoperative cognitive deficits after surgery, because there is a correlation between more medication taken for mental health conditions. The more of those medications, for example, the more Zoloft, the more Prozac, the more modafinil, the more et cetera, SSRIs, SNRIs, stimulants, etc., the greater the risk of having complications related to your mind after anesthesia. Very, very real risks, and ones that we can address by having a solid social support system before surgery to minimize the risks of loneliness and isolation, which will only get worse after surgery if they're not addressed before. And before I give the rest of those general guidelines for risk reduction, I need to address this super thanks from a Cougars Cub. A Cougars Cub. I like your username. Thank you for that super thanks. I had anesthesia having my wisdom teeth removed, says a Cougars Cub. I remember they gave me 2 doses of the white stuff. I could still hear everything the doctors and nurses were saying. I was aware but didn't feel. How common is this? This is anesthesia awareness or anesthesia recall. It occurs in about 1 in 1,000 or so individuals. More common in cases like this that are sedation, like wisdom teeth. Wisdom teeth are rarely removed under general anesthesia. It's typically with sedation given in the IV. It is quite common. It is, I'm happy to hear, not painful. However, it can lead to traumatic experiences that without the right external and internal support can lead to an acute stress disorder or post-traumatic stress disorder. I hope that you had the right support there, Cougars Cub, and that you had not experienced symptoms of PTSD from that experience. Thank you for sharing that, but you're certainly not alone. And for certain cases of sedation, it's not uncommon and it's sometimes expected. The most important thing is that a patient is not in pain during the procedure, because that will certainly increase the risk of bad outcomes if you are aware and in pain versus being aware but not in pain. We've talked about this in many other videos, so thank you for sharing that, and I encourage you to look at those other videos where we talk about anesthesia awareness and PTSD risks. So I was saying the other ways to reduce the risks of mental health complications, having that strong support system is so powerful because of the huge risks of isolation and loneliness. And this is where karma comes in, right, baby? Pet therapy is incredibly powerful, especially in the pediatric population. Did you know that having a puppy to pet after surgery in children has the same equivalence in pain reduction as low doses of morphine? The great difference being that there are no side effects like morphine that we have for pets. One of the most common intolerances that patients tell me about are to morphine, whether it's flushing, nausea, constipation, creepy crawly sensations under the skin, feeling sick to the stomach, etc., etc. Kyle, thank you for that super thanks. I appreciate that, by the way. So pet therapy before and after not only helps for pain, which is heavily influenced by our mental health state, but also influences perhaps our memory. So we're going to talk about memory next. That's number 3, the effects of anesthesia in repeated bouts for surgery in relatively short periods of time. Now, before we get to the memory, I'll quickly say that tolerance to anesthesia clearly increases because we know that the more exposures you have to any anesthesia, the more your body responds by changing the number of receptors, what we call receptor density, throughout your brain and spinal cord and the rest of your body, but we mostly focus on the brain and spinal cord. So for example, if 1 milligram of midazolam knocked you out before surgery, if you've had 3 surgeries, you might need 2 milligrams of midazolam to achieve the same effect. The same goes for opioids. If you needed 50 micrograms of fentanyl for 1 surgery to go through a particularly painful part, you might need 100 micrograms if you have a similar experience, if you've had multiple surgeries, because your body builds tolerance. The same goes for so many other medications, whether they're blood pressure medications, proton pump inhibitors, some medications for depression and anxiety, certainly pain medications, sleep aids, recreational drugs, alcohol, etc. We all know that we will build tolerance the more exposure you have to a substance. Not controversial at all. However, let's go to the memory part. What contributes most to people losing their marbles after surgery and potentially never getting them back? And can pets potentially help with that? Well, let me tell you first off that time and time again, when we give pets to patients, there is a repeated response in patients, and that is that they have a sense of responsibility. It's very difficult to give people a sense of responsibility with a pill. If anything, you might take away a sense of responsibility. As we've talked about in so many other videos, sometimes medications disempower us from taking responsibility for our health, taking away our agency, etc. When you give a pet to somebody, whether it's a dog, whether it's even a box of crickets, when we give boxes of crickets to patients in nursing facilities, we find that they develop a sense of responsibility to take care of the crickets. And something about this sense of responsibility appears to increase their cognitive function, or at least minimize the risk of it declining the way one would expect in elderly people in nursing homes. This is without medications, guys. This is giving a box of crickets. I wish we had more studies on this, but quite frankly, I don't know how many more we need either, because the risks of taking care of a pet, even if especially a small pet, are so little compared to the risks of medications, especially in the population that's most subject to having memory problems after surgery. And that's going to be your grandma and grandpa, the elderly. We like to say over age 65. It can certainly be anyone, but it appears to be in the elderly more. Now, what else contributes to persistent memory problems after surgery? Well, if you're frail before surgery, no question, that will increase the risk because as we age, we have less physiological reserve. What does that mean? This is a really important concept for anyone who's interested in aging or reversing aging or longevity medicine, etc. As we age, our reserve plummets for every organ system. Your kidneys cannot tolerate insults as well the older you get. Your brain cannot tolerate insults. Your heart cannot tolerate insults. Your lungs, your liver, etc., etc. By insults, I mean things like, maybe having impaired blood flow. Impaired blood flow can be like a clot in your brain leading to a stroke, a clot in your heart leading to a heart attack, a clot going to your kidneys, or excuse me, I have to sneeze. Karma got scared. Hey, when you're live and unscripted, you do have to sneeze sometimes, right? So when you don't get enough blood flow to your kidneys, when you're older, they can't tolerate that insult. Less blood flow leads to tissue dying. Not controversial at all. So the older you get, the less your organs can withstand. Hey, thank you for everyone who said bless you, by the way. I appreciate it. The less reserve you have, the greater the risk of bad things happening, like cognitive impairment. So older individuals have less reserve in their brain for things like low blood flow from low blood pressure that might be encountered during surgery, which is why we need to be very careful for blood pressure management in the elderly. If you've had a history of strokes, you have less reserve in your brain because your brain has already been insulted before by that stroke. We have to be extra, extra careful in those patients to make sure they have the right blood glucose levels and the right blood pressure. We need to make sure that substance use disorder is addressed because the more alcohol you use before surgery, the more weed you use, the more other drugs you use, the greater the risk of memory problems after surgery because your brain has already been subjected to these substances in excess. It has already taken a toll on your cognitive health. And then there's the concern for the type of surgery. So when you have major orthopedic surgery, you have risks of blood clots, risks of blood loss, low blood pressure. These can all contribute to memory problems because of strokes, from either low blood pressure or from blood clots. Cardiac surgery, we've talked about before. Open heart surgery, you have to be connected to a cardiopulmonary bypass machine that can send clots to your brain. Emergency surgeries appear to also have an increased risk of memory problems after surgery, as do long surgeries, because the longer the surgery, the more the risk of something bad happening to your brain. And of course, the more surgeries you have, especially in a short period of time, you just simply are adding these risk factors. So this is a major one that we can mitigate by reducing frailty as much as possible before surgery. Once again, prehabilitation, the right nutrition. I've talked about various supplements in other videos. I don't recommend any particular brand at this time, but the general concept of having appropriate nutrition is important. Having the right physical activity, cardiovascular fitness, VO2 max, etc., and the right mental health in terms of anxiety, depression, etc. This does affect our frailty and our cognitive reserve and makes an impact after surgery. The greater our social support is tremendously important, because you know what helps reduce the risk of delirium after surgery? Do you have your sleeping aids? I mean, your hearing aids? Do you have your eyeglasses? Do you have someone to help feed you? Do you have someone who's caring for you? These aren't medications. These are basic humanity-based like connections with people in the world around you. These aren't medications that help reduce the risks of cognitive problems. These are just basic common sense, being human. Human being and not human doing. Matt Mittens, thank you for that super thanks. Matt says, anhedonia. I have post-surgery 2019. I guess you had surgery 2019. I have security clearance, mental health evaluation is off limits. I can't enjoy skydiving or aerobatics. Matt, I'm not too sure what you're referring to there, but anhedonia after surgery can absolutely happen if our depression is either increased from preoperative levels, or if we have new post-operative depression, which can absolutely happen for all the reasons I shared. Matt, I'm sorry that you've had that. I hope you have had success in finding a trusted mental health professional to help you heal from that. Thank you for your vulnerability and sharing. Darcy, thank you for your super thanks. You mentioned ANR, anesthesia-assisted rapid detoxification. Been on methadone for 20 years for chronic pain from a Chiari malformation. First off, Darcy, I'm sorry to hear about your Chiari malformation, but anesthesia-assisted rapid detox is not something that is condoned by any major medical society, has significant risks, especially when performed under the supervision of, pardon me for saying this, marginal providers. So I do not know of any that I can recommend or that I can have any evidence to support at this time. If you have any other evidence, though, please do let me know, Darcy, but I would certainly be very, very, very concerned about ever approaching any of them. So to recap the risks for anesthesia-related complications, we have to recognize that the more your brain is hurting before surgery, the worse it might get after. That's where pets, Karma right now isn't in the view of the camera, but she's here giving me puppy eyes, wanting more treats. But pets can help us with responsibility and purpose and fulfillment. The more of which we have before surgery, the greater our surgical recovery. That's when the majority of these side effects from the anesthesia may come. I wish I could say that anesthesia itself can be changed to reduce the risk, but that's simply not the case. A small exception being how deep someone is under anesthesia. The deeper someone is, it appears that that might increase the risk of memory problems, but we really don't know for sure. But that's, again, why I recommend patients to be clean off of drugs, because the more drugs you use before surgery, the more anesthesia you're going to need, especially weed. Of course, the more anesthetics you get back to back, you're going to have more tolerance and you're going to increase your risks, but you might not be able to change that if you need surgery. But you can hopefully affect substance use. I'm not saying marijuana is bad, guys. You know that I have many videos on cannabis and it can have many powerful properties, but it has to be used responsibly and ethically, which is unfortunately not what I see in many of my patients, at least here in the San Francisco Bay Area. Now, lastly, and Karma's just giving me these puppy eyes for more treats. I wish you could see them as well, but you don't need to have pets. You don't need to drastically change your lifestyle if you want to avoid these risks. But you do need to have a sense of connection with yourself, with your health, because if you can prevent your surgeries in the first place, that's always the best. Heck, I make my living off of people having surgery. So I'm not saying surgery is bad. Sometimes it can be life-saving, but an ounce of prevention is a pound of treatment. So if we can prevent the need for surgery, that's always the best. When we are in touch with ourselves and we have meaning and purpose, we are more able to take responsibility for our health and to be able to try to pursue preventive measures. We can't always be successful, but at least we can try. The more isolated and lonely we are, the less meaning and purpose we have in life, and the less we can be preventive. So please engage in all of your social networks with friends and families and neighbors. Say hi to someone you haven't met before, a neighbor, someone walking down the street. Your smile might make you feel better because we know of that feedback loop in our brain for oxytocin and dopamine to an extent, and serotonin to an extent, and what the other person's going to feel. You might just make their day and help them get this much closer to having responsibility for their health, to help prevent them from maybe needing surgery at some point in the future. And all the side effects we talked about when surgery gets stacked up back to back in relatively short periods of time. So please remember that you have more power over your health than you've ever been told. Surgery isn't bad, but if you can prevent it, which you might be able to for many surgeries, certainly not all, it helps you be in control of your health and help those around you. As always, if you appreciate me coming on these live streams, do please hit that share button and share what you learned with others and subscribe to keep up with all my live streams. Your support helps me do this more often and helps you all share this powerful medical information with others that will really benefit from it.